Hello guys, you're welcome back to my YouTube channel where we learn, we unlearn, and we teach. In today's video, I'll be talking about pre-eclampsia and eclampsia. So what is pre-eclampsia? Pre-eclampsia is a disorder that affects women when they are pregnant. So you can only have pre-eclampsia when you are pregnant, and it affects only women. It usually begins from the 20th week of pregnancy, and in some cases, it can last until the 6th week after the baby is being born. When a woman is experiencing pre-eclampsia, or when a woman has pre-eclampsia, he or she will realize high blood pressure and protein in her urine. The high blood pressure usually begins from 140/90, which is very high even for a normal person, not talking of a pregnant lady. In this situation, the woman can realize, or the woman will start having issues like kidney damage, brain damage, and liver damage. So what is the cause of pre-eclampsia? Pre-eclampsia happens when the placenta is not developing properly as it should develop. This means the blood vessels supplying the placenta do not function properly. So pre-eclampsia has everything to do with the placenta not developing properly. What are some of the symptoms of pre-eclampsia? Now, apart from protein in the urine and high blood pressure, there are also many symptoms of pre-eclampsia, which is very good for every pregnant woman to know. If you are pregnant, you have to pay attention to these symptoms. For example, abdominal pain. If you are pregnant, after 20 weeks of pregnancy, you start having some abdominal pain, please talk to your doctor. Another symptom is nausea or vomiting. If you are pregnant and you are vomiting too much, I know pregnant women do vomit, but when it's too much, then you have to talk to your doctor. Another symptom is headache. If you are having serious headaches with pregnancy, please make sure you talk to your doctor. Another thing you can realize, which is very, very common with pre-eclampsia, is visual problem. For example, you are pregnant and you start seeing stars. This means everything is not all right with you. You have to go to your doctor immediately and complain. Another symptom, which is also common with people who do not have pre-eclampsia, are swelling of the legs, swelling of your hands, and swelling of the face. But it should be noted that not everybody who have swollen legs, face, or hand has pre-eclampsia. Swollen legs is very common with pregnant women. So it doesn't mean that if your legs are swollen, you have pre-eclampsia. But you should pay attention and seek the advice of your doctor. And it should also be noted that not every woman who has pre-eclampsia have protein in the urine. Yes, some women who have pre-eclampsia but will not have protein in their urine. So you have to pay attention to this. And you have to know that pre-eclampsia leads to seizures. That is when you have eclampsia. So when pre-eclampsia, or when somebody with pre-eclampsia start having seizures, it means that person has developed to eclampsia, which is very bad. When you are pregnant and you have seizures, you behave like somebody who has epilepsy. You know, when somebody has epilepsy, the person will be fainting and chewing her tongue. That is how you are being attacked with pre-eclampsia. So now I've talked of the symptoms. So how can we diagnose pre-eclampsia? Unfortunately, pre-eclampsia has no diagnose. It's very funny, right? There is no diagnose. There is no blood diagnose for pre-eclampsia. The only thing you have to do is to take your blood pressure regularly. As a pregnant woman, it is very important to have a blood pressure machine at home. When you are pregnant, take your blood pressure every morning and every evening. If you realize that it is not normal, go to your doctor and talk to him. So there is no diagnosis for preeclampsia. Next thing, how can we treat preeclampsia? It is also very unfortunate that there is no treatment for preeclampsia. That is why I made mention of the fact that it is very dangerous. It is a very dangerous disorder and it only attacks pregnant women. There is no treatment for preeclampsia. The only thing you can do when you have preeclampsia is to give birth. Yes, it's either you give birth to the baby or you risk losing the baby and you risk losing your life. So there is no treatment for preeclampsia. But we also have to know that preeclampsia is not a common disorder, but it is very common with Africans. It is very common with people from the African origin. It is not common with the people in the Western world like the white people, but it is very common with us Africans. And it is also common when you are an African and you have a history of diabetes. Yeah, this is one of the risk factors. If you have a history of diabetes, there is a possibility that you can have preeclampsia. If you are pregnant and you are above the age of 40, there is a possibility that you can develop preeclampsia. If you are pregnant with multiple children or with multiple babies, for example, you are having twins, there is a possibility that you can have preeclampsia. More to that, if you are somebody who is always sick or you are getting sick frequently, when you are pregnant, you need to talk to your doctor because there is a possibility that you will have preeclampsia. That is not all. If you are somebody who is pregnant and you are taking a lot of medication, for example, you are taking medication for high blood, you are taking medication for diabetes, there is a possibility or you have a higher risk of having preeclampsia. That is not all. When you have preeclampsia, what do you have to take note of? You have to take note of your urine and you have to take note of your blood pressure. That is why if you have a sister, you have a daughter, you are a man, you have a wife, please make sure to get a blood pressure machine at home. It is very, very important because as I said earlier, preeclampsia do not have any cure. There is no cure for preeclampsia. It is very dangerous and very common within Black women. Thank you guys for watching. Don't forget to share this video. Don't forget to like. Don't forget to subscribe. In my own little way, I'm trying to create an awareness about preeclampsia and eclampsia for those who do not know anything about this disorder. So please, thank you for watching. Stay tuned. Watch my next video. Bye.